Hey guys, this is with Nursing School Made Easy. Today's lecture is going to focus on tuberculosis. Now, you must know that tuberculosis is caused by something called Mycobacterium tuberculosis. Now, tuberculosis is spread through airborne droplets. So again, you have to breathe these contaminated droplets, and that is how you become infected. So typically, again, this is spread through airborne droplets. You breathe this in, your lungs become infected, but this can also spread throughout your body. So other areas that can be affected are your kidneys, your bones, your brain, and your adrenal glands, just to name a few. Now, there is something called latent TB. Now, in latent TB, the tuberculosis is not active. A person may have been exposed to Mycobacterium tuberculosis at some point. Their immune system was strong enough to stop the spread. It has contained it, and again, it is no longer active. But because you were exposed to it at some time, when you do your TB skin test, it may turn out positive. But again, it does not necessarily mean that that patient has active TB. So if that person were to come next to you, they would not spread tuberculosis, because again, it is in a dormant form. So you must understand that. Now, in latent TB, again, your immune system does take care of the infection. So it kind of puts the bad guy, Mycobacterium tuberculosis, in jail, keeps him there, makes him be inactive. Okay. Now, again, if, for example, the patient becomes immunosuppressed, immunocompromised, for example, an infection with HIV, which again causes immunosuppression, well, your immune system that was making sure that this bad guy was locked up is no longer available, which makes the spread of it more likely. So again, with immunosuppressed patients, immunocompromised patients, you do have a risk of TB spread, or latent TB becoming active TB. So in patients with immunosuppression, I forgot how to spell immunosuppression, so forgive me about that, guys, but in an immunosuppressed patient, we just talked about one patient with HIV, maybe a patient with some type of organ transplant, maybe a patient who is on prednisone or hydrocortisone, some type of corticosteroid therapy, or maybe a patient with diabetes. At some point, these patients will become immunosuppressed. And again, if these patients had some type of latent or inactive TB, this immunosuppression may result in active TB. Okay. Now, what are some signs and symptoms? Let's name a few here. Number 1, fatigue. 2, malaise, feeling tired all the time. 3, anorexia. 4, unexplained weight loss. This is one you must remember. Again, unexplained weight loss. Number 5, low-grade fever. More specifically, night sweats. And chills. So if this patient is complaining of recurrent fevers and night sweats, along with unexplained weight loss and frequent coughing, that should be a big trigger in your mind. Maybe it's TB. In some cases, you may have a patient coughing up blood as well. Okay, so the main ones you want to focus on are an unexplained weight loss, low-grade fever with night sweats, and frequent coughing. Okay, so make sure you know these for the NCLEX. Now, what are some complications due to TB, or active TB in this case? Number one, something called miliary TB. Now, this occurs when TB begins to spread. Remember, we talked about how initially it will be in the lungs. Now, again, if you're immunocompromised or if the tuberculosis becomes spread, it'll go out to other areas. So it'll go, it can spread to, for example, your liver, causing hepatomegaly or enlargement of the liver. Let's go to your spleen, causing splenomegaly or enlargement of your spleen. Can affect your adrenal glands and kidneys. Now, if TB spreads to your spine, this will result in some deformity of your spine, something called Pott's disease. So if you see Pott's disease on your NCLEX, think TB. Pleural effusion. Now, we talked about pleural effusion very briefly in our lecture with pneumonia. So again, you have a bunch of fluid accumulation in the lungs and your alveoli. This would make it very, very difficult for the patient to breathe. So this may cause hypoxemia in your patient. Along with that, altered mental status. Number 3, pneumonia. Again, we're just keeping this very, very brief. So let's move on to diagnostic studies. Now, the first thing that may be done on a patient may be something like a TB skin test. And in this case, you will inject 0.1 ml of PPD, or purified protein derivative. Now, you will inject this intradermally, okay, on the dorsal surface of the forearm. Now, you will read this 48 to 72 hours post injection. Okay, so remember that for the NCLEX, 48 to 72 hours post intradermal injection. Now, you will check for something called induration. This does not necessarily mean redness, okay? So again, you will check for induration. Typically, you want 0 induration. That would mean 0 or no infection. Now, check your books, guys, because it depends really on what type of patient you're examining. For example, in the general public, a induration of greater than or equal to 15 millimeters, that is considered positive for TB. If, however, it is somebody, for example, a recent immigrant, then anything greater or equal to 10 millimeters would be considered positive. So 15 for general public, 10 for somebody like a new immigrant to the country. And greater than or equal to 5 millimeters for somebody who has some type of immunosuppression, somebody who is immunocompromised. So, for example, somebody with HIV, somebody who had an organ transplant, somebody who is on prednisone, hydrocortisone, some type of corticosteroid therapy. Okay, again, those patients are immunocompromised. So for those patients, an duration of 5 millimeters or greater may indicate a positive TB skin test. So again, if you're reading your NCLEX exam, make sure you read carefully what type of patient is it talking about. Is it talking about a just a regular person, maybe an immigrant, or a patient with some type of immunosuppression? So make sure you read that question very, very carefully. Excuse me, very, very carefully. Okay, so that was number 1 for our diagnostic studies. Number 2, you'll obtain a chest x-ray. Now again, you will not read this. Chest x-ray will be performed and it will be read by the radiologist in most cases. You will also do something called a sputum smear and culture. Okay, sputum smear and culture. Now, this is also known as the AFB test. So it stands for sputum smear for acid-fast bacilli, or AFB test. Again, sputum smears for acid-fast bacilli, or AFB test. You also do a sputum culture. Now make sure that these are 3 consecutive sputum specimens on different days. Again, I repeat that, so write that down. 3 consecutive sputum specimens on different days. Okay, now the problem with this is that sometimes this may take up to 8 weeks for you to get the results back. Now something else can be done, something called the quantiferon TB. Now this is a blood test. Now this is a rapid exam. So fast exam, meaning you get results in a couple of hours, okay? So here we have results in a few hours versus results in 8 weeks. Now, we talked about a positive skin test. Well, there's also something called a BCG vaccine. You must be aware of this because in some countries they still give this to hopefully prevent TB in the population. So if a patient was given a BCG vaccine to prevent tuberculosis, most of those patients will show up with a positive TB skin test. Now this is a false positive, okay? It is false because yes, they are positive, but it is due to this BCG vaccine. So that is what's causing the TB skin to be positive. It doesn't mean that they have active TB. In this case, it means that they've been attempted to vaccinate against TB. Okay, so again, make sure you read your NCLEX exam. If you see this, this would cause a false positive for a skin test. Okay. Now let's move on to some drug therapy medications for a patient. Number 1, INH isoniazid. Number 2, rifampin. Number 3, PZA. Or pyrazinamide. Four, ethambutol. Now there are specific things that you must remember with each of these. All of these cause hepatitis. Now hepatitis again just means inflammation of the liver. Okay, so this is non-viral hepatitis. These medications are very, very hard on the liver. So you must get a baseline liver function test. So you're going to get some blood work. You're going to check out the liver, make sure it's functioning right. Because again, these cause hepatotoxicity and can cause hepatitis. So as the patient is getting treated, you want to, like on a monthly basis, get more lab exams of the liver, make sure that the liver is doing okay. So that's number 1. So for INH, you always want to monitor for jaundice. Okay? For rifampin, you have to tell your patient, or you must let your patient know that this can cause some orange tears, sweat, body fluid production. So again, if they show up to your office and they're scared because their tears or their sweat or their body fluids appear orange, well, that's one of the side effects of rifampin. So make sure you let them know that, otherwise they're going to freak out on you. Okay, so that is a big one for rifampin. Make sure you know that for the NCLEX exam, that this again causes an orange coloring of the tears, sweats, body fluids. Okay. PZA, again, it causes hepatitis. It also causes hyperuricemia. Ethambutol. This causes ocular toxicity. So make sure you tell your patient to report any changes in their vision. Any problems with seeing red or green colors. Now, what are some interventions for your patient? Number 1, you will place your patient, you replace your patient in airborne precautions. So you put them in a negative pressure room. That is a biggie. Again, place them in a airborne precautions room, negative pressure room. 2, you'll make sure you obtain that chest x-ray. You'll make sure you get your sputum smear and culture. Okay, again, you make sure you obtain that sputum smear and culture right away. You start them on drug therapy right away. And as always, you make sure you get your baseline liver function tests. You want to make sure that the liver is functioning well. When you enter that room, you must wear a HEPA mask. HEPA stands for High Efficiency Particulate Air Mask. Okay, so you must wear a HEPA mask when you're entering that room. You must teach your patient to cover their mouth and nose anytime they cough or sneeze. You must make sure that they know how to dispose of those tissues properly. Make sure you tell them to wash their hands. So make sure you educate them on proper hygiene. Now, if your patient is going to leave the room, let's say that they go to the radiology department to get an x-ray, or for whatever reason they end up leaving the room, they must wear a standard isolation mask. Okay, they must have a mask on them before they leave the room. Again, you do not want to spread TB to the rest of the patients, to the rest of the facility. So again, if they're leaving the room, they must also put on a mask.